Welcome back. It's 8:42 right now. According to the National Council on Aging, fewer than half of older adults who need mental health care are actually getting it. Half. Dr. Amanda Wakefield is a clinical psychologist with IU Health. She's joining us this morning to talk more about this issue. It's so good to see you. This is a big issue. This is something that I know from my mother, who has been in this industry for years. We talk about it a lot. What is the main, I think there's like three big issues happening right now. Let's start with, what do you think is the top concern?
I think the top concern is just getting people in to see someone. So there are issues with the stigma of looking into mental health. There are issues with being able to find people who know what they're doing to deal with folks who have mental health issues. There are medical barriers to both good mental health and to seeking care for folks in this age group.
Okay, so when you know maybe somebody watching this morning is dealing with this, or themselves, or they have a family member, what do you tell them, or where can they start to try to make life better?
The first thing is really to recognize that it is not normal to have anxiety and depression as older adults. There's this myth out there that everybody has anxiety or depression as they get older, and that's just normal. Well, while it is common, it is treatable, and it doesn't have to be that way.
Yeah, you mentioned too getting people to actually come in. We were talking in the break, and my mom goes now and sees people in assisted living. Hats off to this group that's actually bringing mental health experts in to see people. But even that, it's so hard. What are your suggestions of maybe as community leaders are maybe watching, or things that we need to do to adjust the way we deal with our laws? What can we do to help this? It really is a crisis.
I think the biggest thing is ensuring that we have people to do this work. And I think one of the issues there, of course, is the cost of our education, the ability to receive payment for our services. Particularly with older adults, they're very dependent on Medicare, often Medicaid, and ensuring that we continue to fund those services, and preferably fund them well from a legal standpoint. That's our top priority.
Yeah. I know there's a lot of paperwork, not even paperwork, a lot of computer work now that you all have to do. Like you said, it seems like there are just so many barriers, whether it be just from the person themselves trying to get help, and again, getting people to go into the field and then making it happen. What else we have about 30 seconds. What is your final word on giving that person advice here on taking care of themselves and trying to do that extra work to get help?
I think the biggest thing is to be persistent, to ask your primary care for referral, to ask a nursing home, a assisted living facility for access to those resources, whether those are people coming in. We actually have a lot of ability to seek people by telemedicine.
Yes, that's
one of those great things
that came out of COVID.
Absolutely, and many older adults, if we can get them hooked up to that camera, we can see them from wherever those experts are.
Okay, that is a key.
Absolutely.
Right. Dr. Wakefield, kind of trying to use that technology to really help. Thanks for coming in today.
Thank you so much for
We
having
appreciate
me.
it.